A warm welcome to the Wednesday edition of the Our City COVID-19 show. I am Michaela Miller. These are your headlines. The Health and Other Services Personnel Trade Union of South Africa has called for Tygerberg Hospital to be closed after allegations of reckless violations of fundamental COVID-19 protocols. In Africa, Zambia has relaxed some of its lockdown regulations, and in international news, United Nations Secretary General Antonio Guterres gives an idea of what the world can expect in the aftermath of the pandemic. It is day 69 of the national lockdown, and the current number of confirmed COVID-19 cases stands at 35,812, with 18,313 recoveries and 705 deaths. The Western Cape has 23,568 confirmed cases, 12,436 recoveries and 568 deaths. Cabinet is studying the shock judgment handed down by the Pretoria court on Tuesday that ruled levels 3 and 4 of national lockdown were unconstitutional and invalid. Judge Norman Davis said the regulations needed to be reviewed and amended so as not to infringe on constitutional rights. He directed COGTA Minister Nkosazana Dlamini-Zuma and Cabinet to, within 2 weeks, review, amend and republish the regulations that, in his words, were irrational. He said in a substantial number of instances, the regulations were not rationally connected to the objectives of slowing the rate of infection or limiting the spread of COVID-19. In the meantime, Level 3 regulations will remain in place. Western Cape MEC of Human Settlements, Tertius Simmers, has visited the Roy Ducker housing development in Grabo to assess its progress and to ensure the contractor was adhering to all health and safety protocols. The 79.6 million rand project started construction at the end of 2011. It is expected to yield 1,169 housing opportunities, with 877 already handed over to beneficiaries. A 7-year-old boy from Manenberg was shot and injured in a suspected gang-related incident in Manenberg on Sunday. A 10-year-old girl from Manenberg and a 64-year-old man were also shot and injured in a gang-related incident recently. Community Safety MEC Albert Fritz said there had been a flare-up in the number of gang-related incidents, which he attributed to the breakdown of the truce between rival gangs brokered the beginning of the lockdown. This is what he had to say.
The Minister of Community Safety, Albert Fritz, condemns in the strongest terms the reported spate of gang-related shootings in Manenberg and Lavender Hill. On Sunday, a 7-year-old boy from Manenberg was shot and injured in a suspected gang-related incident in Manenberg. Yesterday, it was reported that a 10-year-old girl from Manenberg and a 64-year-old man were shot and injured in gang-related incidents. Additionally, there is video footage circulating of a gang-related hit in Lavender Hill. The incident reportedly took place on Saturday at 10 a.m. The footage shows 3 men arrive in a silver car, get out, and fire. SAPS have stated circumstances surrounding the murder of that 21-year-old man are under investigation by Steenberg SAPS. A 20-year-old man was shot and injured in the same incident. Minister Fritz said, "Over the past weekend, we have seen a flare-up in the number of gang-related incidents, which is attributed to the breakdown of a truce conducted at the beginning of the lockdown between rival gangs." Minister Fritz added, "I welcome the steps taken by SAPS to deploy additional resources in Manenberg and Lavender Hill, including the anti-gang unit members and other resources to conduct raids and to locate the perpetrators. However, it is imperative that they quickly find and arrest the guilty parties. Anyone with information is urged to immediately come forward and report such to SAPS."
The body of an identified man has been recovered from a location near the Kirstenbosch Botanical Gardens. Wilderness search and rescue were alerted after hikers heard the sound of a rock fall and discovered the body of a man around 60 years old near Nursery Ravine on Table Mountain. WSAR spokesperson Joanne Marais say they were saddened by his death on the first day of the opening on the mountain in terms of the pandemic regulations, and warned that even though social distancing was required, people should not walk or hike alone in the wilderness areas. Meanwhile, in a separate incident, a Table Mountain National Park ranger is recovering from an accidental gunshot wound after he pursued a suspect in Kumachi. Sand Park spokesperson Lauren Clayton said the ranger's official firearm had accidentally discharged, injuring the individual in the upper leg. The matter was being investigated while the ranger recovered in hospital. Healthcare unions are calling for Tygerberg Hospital to be shut down after they undertook an inspection of facility and reported that it had potential of becoming a major breeding ground and killing field for COVID-19. Now the Labour Department is preparing to carry out its own inspection. The 60,000-strong Health and Other Services Personnel Trade Union of South Africa, with the Federation of Unions of South Africa, said they had found reckless violations of fundamental COVID-19 protocols, which included the general public and visitors walking into the facility unchecked and unscreened, and COVID-19 patients not being quarantined safely enough for transmitting the virus further.
Okay, firstly, in terms of what is our concerns, our concern is in terms of the occupational health and safety, as well as the IPC, the infection prevention control compliance at the facility or a Tygerberg Hospital. Looking at COVID-19 regulations and the institution's compliance in line with the COVID-19 regulations. So that is the concern that we have at Tygerberg Hospital. Hence, we have gone to Tygerberg Hospital where we did a preliminary investigation to find out that some of these issues or some of these compliance regulations has not yet been implemented. Yeah. For instance, for a small example, there is no screening of visitors as you even enter the facility.
Yeah. Have you guys been in talks with the Western Cape Department of Health on the way forward?
Yes, we will be having a provincial meeting again tomorrow with the HOD and the provincial management team. On Friday, we will also be having a meeting at Tygerberg Hospital when we're going to do an extended investigation with the Department of Labour to address compliance and challenges. Okay, in terms of the concerns that our members have at Tygerberg Hospital, some of the concerns that stands out is, for instance, your individual risk assessments, where they would look at the staff members' comorbidities, where you would still see that even until today, you would see there's still staff members who have comorbidities, and it's even over the age of 55 that is still at work. The other concern is also, again, where we have seen the rise of complaints in terms of PPE, the protective clothing. The concern now is they've been provided with the needed PPE, but the challenge is now in terms of the red tape, all the red tape they need to get through in order for them to get the PPE, because you say now there's a lot of documentation, there's a lot of stuff that they have to get through.
We are now taking a short break. We'll be back with more right after this. Welcome back. You are still tuning into Channel 263 on DSTV and the Wednesday edition of the Our City COVID-19 show on Cape Town TV. The Provincial Health Department has denied claims of negligence after the family and friends of a woman who died from COVID-19 took to social media to slam the treatment she received. They alleged the Vanguard Community Health Centre turned her away when she wanted to undergo testing, and that New Somerset Hospital refused to assist her, the Cape Times reported. A spokesperson for the Provincial Department of Health Southern Western Substructure, Natalie Watlington, said Alison Isaacs had been diagnosed at the Vanguard Clinic and was referred to the New Somerset Hospital, where she was a patient in the COVID ward before being moved to ICU. With the country easing into level 3 lockdown, which will allow more freedoms, citizens have been reminded of the importance of social distancing and abiding by health regulations. We spoke to Dr. Jose Leklape, President of the Health Professions Council of South Africa, on the spread of the virus among health professionals and how we can work together to curb its spreads. Let's have a look.
Welcome to the RCP COVID-19 show. This morning I'm joined by Dr. Jose, and he's the chairperson for the Health Profession Council. Welcome, Doctor, and thank you for joining us.
Good morning to you and the viewers.
Thank you, Doctor, for joining us. Doctor, as we see the number of essential workers or staff at hospitals infected or get infected with COVID-19, what is the current state of all healthcare practitioners when it comes to being infected by the dreaded coronavirus?
I think the only numbers we have will be the numbers that you both have from the Ministry of Health, because they would be the ones that collate the data. But as the number of people increase in hospitals globally, what we've experienced is that, up to 10% of the infections at any point in time at the peak might be in healthcare professionals.
Yeah. And Doctor, we have seen various doctors, come from across the world. How does this help, the spread of COVID-19, and how does these doctors actually help fight and combat the dreaded virus?
I think we only have Cubans that have really come into South Africa at this point in time. All other countries are retaining their own doctors and are trying to recruit from elsewhere to meet their healthcare needs. Cuba is the only country that is a net exporter of medical doctors, and is the only nation that has shown preparedness to help others. We're not the only people that have received Cuban. They've been received in Italy, they've been received in other parts of Europe, they've been received in Latin America. Yeah. So they are the only ones that have a capability, that have produced enough doctors for their own needs and are compassionate enough, as their father of the revolution, Fidel Castro, said, that they are not going to send out bombs to other nations, they'll send assistance. And true to those words, assistance has been sent to South Africa.
And Doctor, as we entered into level 3 of the lockdown, and we know that the Western Cape is actually supposed to see its peak at 80,000. Can we expect more healthcare professionals to be infected with COVID-19? And are our hospitals capable and ready to combat and fight this?
I think we've now moved to the top 20 in terms of new infections. About 2 days ago, we were number 13. And as healthcare professionals, we are not immune from what happens in society. And as the rate of infection goes up in society, so it will in healthcare professionals. We are members of society. We live in those hot spots. We live in those communities. And we just have a double whammy of also having to work in that environment.
Yes, Doctor. And recently we've been speaking to traditional healthcare practitioners, and they were saying that they can also help combat spread the virus. So if we combined our doctors and our traditional practitioners, could we see a cure to the virus?
I think people have to understand that combating the spread of the virus is not in the hands of healthcare professionals, whether they be traditional Western medicine, allopathic. Prevention is in the hands of the community, because transmission is from person to person. We have community spread, and all of us as members of community have a role to play in curbing the spread. What healthcare professionals can do is to continue the educational messages to the public of hygiene, hand washing with soap and water, physical distancing, cough etiquette, and more importantly, as science has shown, covering your mouth and nose with a cloth mask or a face shield. Those are the things that all of us collectively can do. And those that are healthcare practitioners would have a role in continuing to spread that message.
And like you said, Doctor, that will now become our new norm. And as we go further into the future, what can we see as South Africans going forward, and as we potentially see a total ease to the lockdown, what can we predict as a country?
I think what the people in the Ministerial Advisory Committee and the scientists have said is that this is going to be with us for at least one more season. So this is not just an issue of 2020. It's being predicted that it will be with us till 2021 minimum, and others are projecting even beyond that. So washing of hands should have been a norm in society. Some of us have been trying to promote washing of hands for the last 15 or more years. So washing of hands is not something that we do in relation to COVID. It's something that we should be doing day to day. We have other infections that cause mayhem. Diarrheal diseases in children, pneumonia, the flu, the normal flu season. All these infections can be kept by the washing of hands. So our health will improve, we will decrease costs on the healthcare system, and we will decrease mortality by just going into the habit of washing of hands at least 10 times a day on particular instances, after use of a toilet, before eating food, coming from outside, after touching surfaces, when hands are visibly dirty. This should be norms. It should not just be COVID-19 related norms. But there are extra precautions that we could take in times of flu pandemic. Remember, this is nothing new. We've just taken it for granted. If you remember, you've had people that have flu, and responsible citizens will say to you, don't come near me. I've got a touch of flu. I don't want to pass it. So the notion of physical distancing is something that has always been known. We just take it for granted, and we don't do it routinely when it is necessary to do.
Yeah, rightfully so, Doctor. It's true what you're saying. Last question before we end, Doctor. Now that everybody's in a panic about COVID-19 and we're not necessarily seeing a cure anytime soon, does this affect other types of illnesses like your HIVs and your TBs and your pneumonias? Does this in actual fact put all other diseases on the back burner as everybody's focus is solely on the COVID-19 pandemic?
I think we don't know what the interaction between COVID-19 and HIV will be. But knowing that people with HIV are immunocompromised, we concerned about that population group. And they should be extra cautious in terms of contraction of COVID-19 because they have a comorbid disease. Now, in terms of displacement of others, that is pretty unfortunate because of what we were seeing all over the world. What we saw in Spain, what we were seeing in New York, we all panicked around COVID-19. And part of it is that we now have to have a sober conversation, being mindful of the highly infectious nature of COVID without being paralyzed by it. Yeah. We must understand that when we say it is in our hands, it is truly in our hands. And that is why continuing education is important, so that people understand that this is going to be with us for quite some time. And these things that we're talking about of hand hygiene, sanitizing, physical distancing, cough etiquette, covering of the mouth and nose with a triple layered cloth or a face shield have to be the norm for the next 2 to 3 years. And some of those behaviors, like hand washing, has to be part of what we do forever and ever. Now, what is happening is because of the fear, people were now scared of going to the hospital for fear of getting the infection. But if you go back to 2 months ago, we had very little COVID in the hospitals. It was still in the communities. We could have managed the situation better in terms of ensuring that there's safe access to continuing medical care for other chronic conditions. We now need to pick up that baton and send a message to people that it is important, if you have chronic conditions, that you continue to receive the care that you need for those chronic conditions. Whether you are asthmatic, you have heart disease, you are hypertensive, you are diabetic, or you are living with HIV, please ensure that you continue to access treatment. We also need to be mindful about our population that are living with disabilities, that they are not touched of the care that they need. And all of us just need to be sober about this issue. Respect the distance. Cover your mouth and nose. Wash your hands frequently. That's key to overcoming COVID. Overcoming COVID does not lie in institutions. It lies in communities. It does not spread in institutions. It spreads largely in communities.
Thank you so much, Doctor. Thank you for joining us and thank you for giving us of your time. And like you rightfully mentioned, this is a disease that is going to stay with us for the next few years. And it's the onus then falls on communities and citizens to adhere to social distancing and the washing of their hands daily. Thank you so much for joining us. Thank you for your time, Doctor.
Thank you. Just remember, put others first and all will be well.
We will do so. Thank you, Doctor.
Food for Life, an organization that aims to eradicate hunger and bring relief to various communities in need, has a food-a-thon this past weekend in efforts to bring aid to communities in distress during the COVID-19 pandemic. To ensure that all communities are taken care of, organizer Nainesh with his team in working tirelessly to fight hunger during this pandemic. This is what he had to say.
My name is Nainesh Deva. I'm in Cape Town at the moment. I've been involved with Food for Life for the past 7 or 8 years. So Food for Life Cape Town, with the only branch in the Western Cape, we've got about 50 branches nationwide. And we're also part of a global organization, Food for Life Global, which is operating in about 80 different countries. Pretty much what we do is trying to eradicate hunger and malnutrition. So on a worldwide basis, we cook and distribute plus minus 2 million vegetarian meals on a daily basis, which is more than all UN efforts put together. In Cape Town, we currently operating twice a week. We cook and distribute food twice a week, for now on a Wednesday and Saturday. On Saturday, this past Saturday, we had a massive food-a-thon. So Food for Life stopped operating when we went into lockdown level 5, but then we obtained the necessary permits to operate again around the 10th of April. And Food for Life Cape Town has been operating since the 15th of April. So countrywide, on a national level, we've distributed close to 500,000 meals, vegetarian meals, up to last week. So on Saturday, there was a big initiative, big food-a-thon, where all participating branches were encouraged to cook and distribute as much food as possible. And the aim of that was to push us beyond the 500,000 meal mark. In other words, to get us beyond 500,000 meals since we started operating in lockdown. So 20 branches participated. We were hoping for about 108 pots of food, and we actually ended up cooking and distributing about 324 pots of food. That's about 75,000 meals countrywide. Also, this past weekend's initiatives and efforts have taken us to plus minus 600,000 meals since lockdown, in other words, in the past 6 weeks or so. So that's a tremendous achievement for Food for Life on a national level. And Cape Town, we pledged about 64 pots of food, so we cooked and distributed 64 pots of food, which is the equivalent of 12,800 vegetarian meals. And that went to about 72 different communities that came to collect food. So it's our biggest undertaking this past weekend. And thanks to the amazing support from all our volunteers, donors, sponsors, etc., we were actually able to get all 64 pots sponsored. So an amazing achievement for us, and we're grateful to all who assisted. Food for Life started in India in the 1970s by a gentleman called Srila Prabhupada. He's left this world quite some time ago, but his force and inspiration is still behind all the Food for Life branches operating globally. So prior to lockdown, definitely we would cook on a weekly basis. Some of the food we cook would be collected by other organizations, NPOs, individual church groups, mosque groups, etc. And they would take that food to their respective communities. And some of the food we would take to our distribution points. We usually distribute food in one of 7 or 8 different areas in Cape Town, such as Mitchell's Plain, Tafelsig, Hanover Park, Philippine, Nyanga, and as far afield as Stellenbosch and Grabouw. So we do that on a regular basis, on a weekly basis. For lockdown, we've decided to focus on cooking only. So we're inviting other organizations, NPOs, doesn't even have to be NPOs or registered organizations, just individuals who are working very closely with their respective communities. So they've been coming to collect food whenever we cook. And to date, it's probably close to 200 different communities that we've assisted with food donation. Food donations being freshly cooked food, nutritious food. People can contact me on 079 4877 169. That's 079 4877 169. Our email address is foodforlifecapetown@gmail.com. It's foodforlifecapetown, one word, @gmail.com. We are also on Facebook and Instagram. Just look for Food for Life Cape Town. So in terms of monetary assistance, we're happy to share our details or send debitory forms. But there's also many other ways that people can assist besides with monetary donations. We need help with fundraising and social media. We need help putting together a portfolio because we need a bigger kitchen. So we need assistance with that. If someone can give us 5 million rand, we'll put up a new kitchen. But also in terms of people coming to us for assistance, there's no formal process. People just get in touch with me on the details I've provided, cell number or email or via Facebook or Instagram, and we'll take it from there. Many of the organizations that came today, for example, have been referred to by their friends and family. So we're more than happy to help as many individuals, organizations, church groups, mosque groups, whatever. We're more than happy to help wherever the need is.
Zambia has relaxed some of its lockdown regulations. The following video by Voice of America looks at how the media in the country has been reporting the COVID-19 outbreak. Let's take a look.
Welcome to Africa 54.
Thank you so much, Paul, for having me on this particular platform.
How are things in Zambia? I know the lockdown has been relaxed a little bit, but how has the lockdown impacted you as a person, businesses, and a lot of people in Zambia?
My work involves moving around. My work involves meeting people around. So during this partial lockdown, or when we had so much, restrictions in terms of movement, in terms of how you conduct yourself, my work has sort of been impacted to the negative. As a journalist, you always get information through interacting. You always get information through meeting different people. So it has been a little bit of a challenge because I have not been able to move around and do my work as I used to do it. And in terms of businesses around, most businesses have been impacted negatively because they can't trade as they used to do. They are always the numbers of people that are going out there to go and buy or to go and trade are very few because everyone has been trying to stay indoors.
How is the journalistic community, or you as a journalist, in that country really trying to tell that story. How are you covering COVID?
We are covering COVID from, I would say, two angles. So the one aspect is, where you get these statistics from the health experts, from the Minister of Health and others in charge of giving out information. Then we disseminate that. Then the other angle is, where I'm talking about, the need for us journalists, to up our game in terms of putting that human face on to COVID. Let's just not do stories. 500 people have tested positive to COVID-19, but we are also doing stories to say, okay, among those 500, there are 5 doctors, but what does this mean in terms of the health sector? We have 5 doctors that have been, removed from their workstations into isolation facilities. How is this affecting, the health sector? And I've seen quite a number of journalists, doing such stories, which is very commendable. I've seen journalists, focusing on issues to do with, sexual reproductive health and rights, SRHR, which is, has been, left out or forgotten. So I've seen journalists doing such stories, which is very commendable, which even asks government or reminds government to say, even if we're fighting COVID-19 this side, let us not forget other key issues that we need to fight, such as, HIV and AIDS, such as the provision of sanitary towels, to girls in schools. So I've seen a number of journalists, doing those particular stories, which are quite encouraging and quite positive. And I must say that I think that the Zambian journalists are doing everything they can, to report about COVID-19. But of course, we could do more.
You talked about social distancing. You come from a country, I've been there about 3 times, and I've crisscrossed the country. People like to party. Zambians like to hang out. They like to be with friends. They like to drink that beer. When you talk about social distancing, how is that applicable in a country where you are?
Well, of course, Zambians like their drink. Yeah, it is applicable in most places. Social distancing is being observed, but not everywhere. But there are certain places where you just can't get social distance. A popular trading area around Lusaka, which is called Soweto Market.
I've been
when
there.
you go that side,
Yes.
you've been there.
Yes.
When you go that side, you think you are in another world. That you think that COVID-19 doesn't exist. But when you move from that particular side to other places or other shopping malls, you don't foresee that social distancing.
Well, Arthur Davis, thank you so much for your insight.
That's all from the news run, but when we come back, we look at what's making news on social media. Welcome back. You're still watching the Our City COVID-19 show. I am Stephanie Pitt. The post-COVID-19 world will come with unique economic challenges. United Nations Secretary General Antonio Guterres tables what needs to be done to deal with the trials that will face us in the aftermath of the pandemic.
I thank you all for your solidarity, and I thank the Prime Ministers of Canada and Jamaica for co-hosting this meeting. Unless we act now, the COVID-19 pandemic will cause unimaginable devastation and suffering around the world. Hunger and famine of historic proportions, 60 million more people pushed into extreme poverty, up to half the global workforce, 1.6 billion people without livelihoods, a loss of $8.5 trillion in global output, the sharpest contraction since the Great Depression of the 30s. We must avoid it. The pandemic has demonstrated our fragility. Despite all the technological and scientific advances of recent decades, we are in an unprecedented human crisis because of a microscopic virus. We need to respond with unity and solidarity. And the key aspect of solidarity is financial support. I welcome the swift actions that have already been taken by the International Monetary Fund, the World Bank Group, the regional development banks and other international financial institutions, and the G20. But many developing countries lack the means to fight the pandemic and to invest in recovery. Excellencies, today we are asking for immediate collective action in 6 critically important areas. First, global liquidity. A rush to safety has triggered an outflow of capital from some key emerging economies. And many other countries have seen their fiscal space reduced by the virtual standstill of economic activity, preventing them from being able to import essential medical supplies. This is where the health crisis meets the economic crisis, in a dangerous nexus that would prolong and deepen both. Existing mechanisms are stretched to capacity, and the resources of the International Monetary Fund may not be enough. We have the tools to enhance global liquidity. I urge you to use them, and especially to consider a new issuance of special drawing rights. Second, sovereign debt. The economic fallout from the pandemic threatens to cause a wave of defaults in developing countries. Widespread debt crises will set back the response to COVID-19 and impede sustainable development for many years to come. The countries affected would have no prospect of achieving the sustainable development goals. The G20 debt moratorium is a first step, but it only covers the least developed countries. I recently had the opportunity to visit several Caribbean and Pacific islands, middle-income countries that have made steady economic progress despite being on the front lines of the climate crisis. Thanks to early and decisive action, they have largely been spared the health impact of COVID-19. But many are heavily indebted, and their economies are now in free fall. Small island states rely heavily on tourism and remittances. Both are now at a standstill. Households that had a secure income are at imminent risk of poverty and hunger. Many developing and even middle-income countries are highly vulnerable and already in debt distress, or will soon become so due to the global recession. Alleviating crushing debt cannot be limited to the least developed countries. It must be extended to all developing and middle-income countries that request forbearance as they lose access to financial markets. We urgently need durable solutions on debt to create space for investments in recovery and the sustainable development goals. My third point concerns the private creditors, who hold a growing share of developing countries' sovereign debt. Any comprehensive solution on debt must include constructive dialogue towards engaging these creditors to find solutions. We need creative ways and incentives to encourage commercial creditors to join debt relief efforts. Fourth, external finance. Direct investment, exports and remittances are dropping sharply. We cannot allow this decline to become entrenched. We need a clear signal of confidence to boost and relaunch investment.
We do apologize for the poor audio on that insert. Now let's take a look at the popular hashtags on Twitter today. Hashtag SASSA. Some are dancing with delight on receiving SASSA's social relief grant of 350 Rand. Others are still waiting and demanding 700 Rand for the month of May and now for June as well. Hashtag Tsego must fall. The woman behind controversial Twitter and Insta accounts has raised anger of the tweeps with a tasteless comment about rape. South Africans are not impressed. We'd like to know your views on burning issues during this pandemic, so we'll be posting burning questions on our Facebook page, Daily Our City CT. You can also follow us on Twitter at Our City CT. That's it from me, Stephanie Pitt. Please stay with us. After the break, Michaela Miller will be giving you information on resources and places of safety you can access during this period. Stay with us. Welcome back. You're still tuned into Our City, the COVID show on Cape Town TV, channel 263. If you are in need of any assistance, here are some organizations helping communities stay safe during this period. That's it from the Our City COVID-19 news show, but we will continue giving you the latest news on what's happening in Cape Town on our Facebook page at Our City CT and on Twitter at Our City CT. You can also get in touch with us via email ourcity@capetowntv.org or call us on 021 448 0448. From me, Michaela Miller, and the Our City News crew, enjoy the rest of your week.